This is Rise. Let's lock in with the goal of changing one life at a time. Yours. Together, let us rise up, inspire, strengthen, and elevate our minds. It's time to Rise on the voice of Nassau Community College, 90.3 WHPC.
Hello, my name is Dr. Saran Heron, and welcome to Rise. Today we are going to talk about health preventative measures. My guest today is Allen Daugherty. He is a registered professional nurse. He has worked in the medical field for almost 50 years, first as a U.S. Air Force medic, then as an RN and certified dialysis nurse. Allen believes that the American healthcare system is designed to focus on diseases after they happen. And so he's dedicated his time to educate others how to change one's mindset to focus on prevention. He is also the founder of P.H.A.S.E, Preventive Health and Safety Engagement. Allen will share the top 5 health screenings that could save your life and when to get them. He'll discuss the types of screenings, lifestyle changes, and other preventative steps we can take before becoming another statistic. He is also the author of An Ounce of Prevention is Worth More Than You Can Imagine. He is here to change the way you think and encourage you to change your current lifestyles and rise above health problems by implementing better choices. Allen Daugherty, welcome to Rise here on the voice of Nassau Community College 90.3 WHPC.
Thank you so much for having me. It's quite an honor to be here with you, Dr. Heron.
Yes, we're happy to have you. So, Allen, you served in the United States Air Force as a medic. What was that like? What were some of your responsibilities in that role?
Well, the last half of my career was really special because I was sent to special training and then sent to Air Force bases, radar sites all over the world that did not have physicians. So they kind of trained us to do all the things that a physician would do.
Wow.
And we did minor surgeries, sutured, had a really good time trying to educate the military people and their dependents a little bit about healthcare, and then, of course, taking care of all the illnesses and injuries that came along.
Wow, that's amazing. Now, why did you pick nursing as a profession? I know you were a medic, but why did you decide that you want to do nursing as your, which is your current profession now?
Well, truthfully, I've always wanted to be a physician. And I was in the service for 12 years when I got out. We had half of our 4 children, and the other half came along. And I just was not able to get into that type of academic endeavor. So I got into nursing school because I was able to do that while I was working full time. And I just thoroughly enjoy the contact I have with the patients, more often probably than physicians will get a chance to. And actually, currently, I'm in nurse practitioner school. So I'm kind of getting close to my dream.
Wow. So the journey never stops. That's so exciting to hear that. Now you currently, in your current role, you care for dialysis patients. Speak to me a little bit about that for those that may be listening who are not sure of what a nurse's role is in caring for a dialysis patient and what you do for those patients that you care for.
Well, dialysis patients really have a lot of needs. Most of them aren't there just because their kidneys failed. I mean, that's why we do the dialysis, but they have so many other conditions. So physically, we do everything we can to monitor them and to try to provide the best type of lifestyle they can have while they have this terminal disease. Then on the other hand, it's a very taxing condition on your mental and emotional state. You think about it, someone tells you you have a terminal illness and you have to dialyze 3 times a week or you will not survive. It really is harmful to your mental status as well as some of the things that, you lose hope, you lose sight of any type of possibilities, family gets upset. And then the real big thing that I found is these patients feel like they're a burden now on their family. And I know that's not the case, and we spent a lot of time convincing them of that. But as a matter of fact, in one of my clinics, we have a couple LVAD patients,
Right.
which are left ventricular assist devices. They actually have a pump
Hmm.
placed inside their heart. And if they didn't have that, their heart wouldn't be beating strong enough to keep them alive. So we have quite a few things that we monitor,
Right.
and it's very rewarding to be able to see patients. We had a lady come in probably about 8 months ago, and I didn't think she would make it 2 or 3 treatments. And yesterday she was smiling, all dressed up, makeup on, and told me she was driving again. So
Wow.
it was just, so that just makes all the difference in the world.
Amazing. I'm sure it's a tough job, but it's also a rewarding one that you seem to enjoy. Now you're the founder of P.H.A.S.E. So how did you come about, establishing that organization, and what is your mission? If you could share that with us.
Our mission is basically to create awareness that most people aren't aware of
Right.
how important
Yes.
preventive health and safety is.
Yeah.
When you look at the statistics and you watch people throughout your healthcare career that come down with chronic illnesses, that die prematurely, who leave families behind, and with no doubt some of these conditions and some of these accidents could have been prevented.
Absolutely.
Senseless deaths just bother me, and senseless
Mhm.
injuries. I was working in the emergency room in a hospital not too far from here, and there were some young people out drinking, got into an accident, and one of the victims was just really, I mean, he was really injured badly. And so we stabilized him so that he could be helicoptered to a nearby hospital. But it was very apparent that he had a fracture somewhere between his neck and his upper back, and he was going to be paralyzed for the rest of his life. This boy was one of the top students in the school. He was on the football team. He was loved by everybody. Now he's going to spend the rest of his life, and I'm not even sure how long he would live. But whatever life he had left was just totally ruined. And you see that over again, Dr. Ron, and it's just something that breaks your heart, thinking that it was preventable. Hey, don't drink and drive. Hey, don't text and drive. Get some screening so if you do have an illness or something growing in your body, it can be taken care of. And it's so preventable. An ounce of prevention is worth more than you can imagine. That's the title of the book, and that is so true.
Especially with the quality of life that you really want to live. Now, as you mentioned, you're passionate about educating others and you focus on disease. You mentioned that, we focus on disease. Well, America focuses on disease after they happen. For our listeners, explain why do you say this? I know you've been saying it a little bit in our intro, but why do you say we focus more on treating them versus providing the proper tools that individuals will take care of themselves and not end up in the position where they weren't educated, they weren't given access information until it's pretty much kind of too late?
Yeah, well, that's a really good point, and that's why we've created P.H.A.S.E. to try to create this awareness. When Obamacare came into being, that provided millions of more people the opportunity to have preventive health care, to be able to get screenings, to be able to get free doctor's appointments, to be able to give this opportunity to people who before would have never had it. But the statistics proved that most of the people never took advantage of it. They didn't get the screenings. They didn't come in for exams. So they have something like high blood pressure or diabetes that goes unchecked for years. And because it's not bothering that much, they never seek medical attention until they have a heart attack, until they have a stroke, until they have kidney failure. And then they're strapped in. There's nothing they can do about it then except take the consequences of what the conditions like.
Now, you also, we are talking about health preventative measures, and you believe that there are some screenings one can do to ensure that they are on the right track as it pertains to one's health. Talk to us about some of those screenings that you believe are very crucial and essential to one's health.
Yes, and screenings vary from person to person. And that's
Absolutely.
why it is so important. And if you don't do anything else, have an annual physical. Get in there and see your doctor. Because when you go in and see the doctor, you start talking about family history. So someone
Right.
that's 50 years old that doesn't have a family history of cardiac issues may not need to have any type of stress test or any other type of diagnostic work to see how their heart's working.
All right.
But someone who has a real strong history of high cholesterol, high triglycerides, and a family history of coronary artery disease, that physician is going to want to start ordering some tests and putting them through some different things like a stress test that would be able to see what their cardiac function is. The same goes with diabetes. The same goes with women and breast cancer. They're cutting back on some of the different tests, pap smears, breast cancer exams, mammograms. But the truth is, if they have a strong family history, then that dictates when those different procedures and tests should be done. So can't stress how important it is to see a physician, let them know your family history, let them know your current status, any symptoms you might be having, any problems you might be having, and get that examined every year, and then follow up with all the recommended exams and screenings that they give you.
You are listening to Rise on the Voice of Nassau Community College, 90.3 WHPC. My name is Dr. Saran Heron, and today we're talking to Allen Daugherty. He is a registered professional nurse. He has worked in the medical field for almost 50 years, first as a U.S. Air Force medic, then as an RN and certified dialysis nurse. Allen believes that America's healthcare system is designed to focus on diseases after they have happened. And so he dedicates his time to educate others how to change one's mindset to focus on prevention. He is the founder of P.H.A.S.E, which is Preventative Health and Safety Engagement. Allen will share with us top screenings that he believed that could save your life, when to get them. He'll discuss the type of screenings, lifestyle changes, and other preventative steps we can take before becoming another statistic. He is also the author of An Ounce of Prevention is Worth More Than You Can Imagine. He is here to change the way you think and encourage you to change your current lifestyles and rise above health problems by implementing better choices. Now, Allen, we just finished talking about screenings. Now we want to get into lifestyle changes. Share some changes that individuals can begin to make in their lives.
Well, the truth is, if you look around America today, you can tell that the vast majority of people are overweight or obese. As a matter of fact, statistics say that about 90% of the U.S. population is either obese or overweight according to the BMI, which is the body mass index. The lifestyle change that is the most important is thinking about how we eat and what we do with our time. It used to be that, there was quite a bit of activity. Mom cooked at home all the time. And, you got together for a family meal, and then you went outside and played. We were much more active back then than what we are today. And today it takes a couple of people to work to provide an income. Mom works, dad works, kids go to a babysitter, so forth back. And then when you get home, everybody's too tired to cook. You're too tired to go out and get some good meal, get some fresh vegetables and things like that would really be beneficial for your health. So it's fast foods, pizza, just anything that you can eat quickly. And then when everybody gets done, they're just kind of tired, settle in. The kids go play video games. Parents sit on the couch and watch television. And that's why we have the problem today that we do. And that's why when we talk about lifestyle change, we talk about actually changing habits. Habit change is a topic that everybody ought to spend some time listening to, because there's only one way you're going to change, and that's change your habits. And that can be done by simply repeating a lifestyle change over and over again. We are going to have some meals. We're going to plan them out for the week. This is what we're going to have. I'm going to stop and get this. We're not going to have chips anymore in the house. We're going to have some fruit to eat. We're not going to be able to have pizza every night or go out to eat every night. We're going to really plan some well-balanced meals. And then we're going to spend some time doing things outside and getting some activities, maybe join the gym where everybody can go and the kids can swim while you do some work on the treadmill and some weightlifting or something. But it has to become a habit. It has to be a lifestyle change. This thing where you do it for just a little while and quit, it won't do your health any good because you'll be right back to where you started.
I have to agree with you. And it's also not an overnight thing, right? It takes some work, some effort, and like you said, just major changes that will really benefit you in the end. Now, in terms of kidney failure, for those who are not nurses or in the healthcare profession, what would you say are some of the leading causes of kidney failure?
The two biggest causes of kidney failure, without any question at all, are high blood pressure and diabetes. The problem with both of those is that you can have them both for a very long time and not even know it. That's why it's so important to have screenings. That's why I think we ought to be getting into our schools, our colleges, and just every chance we get, let us do some screening on you. You could take a family history and find out if you have diabetes in the family. If so, let's do that screening test and see. Let's do a blood sugar and see what you are, your A1C. Same thing with high blood pressure. There are blood pressure machines all over the nation today. Almost every drugstore you go into, every supermarket like Walmart and others, they all have blood pressure machines. You can check your blood pressure. But people have the attitude, if it's not broke, don't fix it. So that means that if I'm not feeling bad, I'm not worried about it. And then they end up coming to see us in dialysis clinics 3 times a week.
Right. You're absolutely correct about that. Now, bring us back in time, even to coming to the program today, because you feel that individuals really lack the knowledge. What are some other contributing factors that you have not mentioned yet that you think really contribute to individuals not knowing, like those who are not nurses, who are not in the healthcare profession? I know you mentioned going to doing your annuals, but what do you think are some of the main reasons why individuals who are not, seeking information, why are they lacking this knowledge that we would hope that many people today have, being that we have access to internet? We have books we could buy, things we could read.
I think the sad part is that a lot of people do know. It's just that they're so wrapped up in other things in life that it takes way back on the back burner. I mean, it's just, it's way down on the list of priorities for them. They've got to make a living. They've got to raise their children. They've got to, get that business off the ground. They've got to get that next promotion. Everything that you can imagine in front of really taking good care of your health. I was talking to someone not too long ago, and they told him that, he needed to have a colonoscopy because he had a family history of colon cancer, and he actually had seen a little bit of blood in his stool, but he thought it was just a hemorrhoid, wasn't worried about it. And the doctor, just about had to beg him to get this test scheduled because he says, blood in the stool is one of the primary signs of colon cancer. And, with a family history of it, you're 50 years old, it's time to have a colonoscopy. But it's just so sad. I don't know if you've ever seen it on TV or not. There's a commercial where a woman is actually holding a voice box up to her throat.
Yes,
I've seen it. And she's talking about all her activities of the day. She probably weighs about 70 pounds. You can tell she's not far away from death. And cancer has totally riddled her body. And she warns people about how terrible it is to smoke. Yet still, in America, millions of people smoke. So it just goes without saying that I think we ignore the signs. We just don't pay attention to the things that, because we have the attitude, it won't happen to me. Mm-hmm. I can drive down the road after having a few drinks. I'm not drunk. I'm not going to get into an accident. I know other people do, but not me.
Right.
Or, I can just look at that text real quick, or I don't have to have smoke detectors in my house. And my children don't have to wear helmets when they ride their bike. I never rode a bike with a helmet. Why would they have to wear helmets when they ride their bikes? Yet every year, hundreds and hundreds of children have brain injuries because of riding bicycles without helmets. It's just unbelievable how we jump in and jump on the bandwagon for so many different things in life, but we've let healthcare go. And that's why our healthcare system is such a mess. I mean, financially, you would be sick if everybody in America realized just how red, the healthcare system is. And it's because we're taking care of so many preventable diseases and accidents.
You are listening to Rise on the Voice of Nassau Community College 90.3 WHPC. My name is Dr. Saran Heron, and today we're talking with Allen, who is a registered professional nurse. He has worked in the medical field for almost 50 years, first as a U.S. Air Force medic, then as an RN and a certified dialysis nurse. Allen believes that the American healthcare system is designed to focus on diseases after they have happened, and so he dedicates his time to educate others how to change one's mindset to focus on prevention. He is the founder of P.H.A.S.E, which is Preventative Health and Safety Engagement. Allen will share the top health screenings that you should get to save your life and when to do them. He discussed different types of screenings, lifestyle changes, and other preventative steps we can take before becoming another statistic. He is the author of An Ounce of Prevention is Worth More Than You Can Imagine. He is here to change the way you think and encourage you to change your current lifestyles and rise above health problems by implementing better choices. Now, Allen, as we've been talking about healthy lifestyle, it's something that you encourage others to look at. What are some food choices that you want to share that individuals should avoid consuming?
Well, there's just so many things that we don't even think of. And I just jotted down a few here that I feel like, really you would stick out. Canned foods. They actually put preservative called BPA in canned foods that really, in order to preserve things. But the truth of the matter is it's very unhealthy, carcinogenic items that are bad for you. Now, put that in with acidic tomatoes, and that acid actually activates the lining inside the cans, and they have shown over and over again how bad that is. We talked a minute ago about margarine and butter. Everyone thought that margarine was the answer because it was lower in this, lower in that. But the truth of the matter is there are so much more things in butter that are better for you, actually, and things in margarine that are really harmful to your health. The hexane, the other solvents, trans fats contributing to heart disease, cancer, hormone imbalances, all kind of things. Then you talk about vegetable oils, processed meats. Let's not even get into sausage and hot dogs. I mean, please, those things are things that we all loved. I don't know about most of the listeners, but I grew up in a fairly poor family, and we ate pasta all the time. We ate, I was in the service before I realized people put meat in their spaghetti. It was like, they put hamburger in the spaghetti. What's up with that? But, we just ate the noodles. And, we ate that all the time. We ate hot dogs, and all that stuff is just so bad for you. There's so many things, bacon. And we love it, and it tastes good. And I was talking to someone the other day about my podcast. And they said, after listening to you, it sounds like you can't eat anything. I said, well, it may seem that way, but the truth is there's a lot of good alternatives out there. Microwave popcorn. Please stay away from microwave popcorn. Popcorn itself is not bad for you. But the microwave popcorn inside the bags, they put something in the lining to keep the grease from soaking through. And when it gets heated up to a certain temperature, it dissolves and gets all over the popcorn. And so you're eating all kind of terrible things. Artificial sweeteners, for example. Everyone thought, no more sugar. I won't get diabetes, but artificial sweeteners have all kind of things in there that are going to be considered carcinogenics pretty soon. And actually, the way it works in your body, it gives your body more of a craving for sugar than just having regular sugar. Table salt. Get rid of that and get yourself some good sea salt, because sea salt's so much better for you. Table salt has a lot of different chemicals in it just beside sodium and chloride. Potato chips. They actually said, and I'm going to quote this, 1 ounce of regular potato chips contains 152 calories, 10 grams of fat, 3 grams of that are saturated fats. Just 3 ounces a week can add about 7 pounds in a year.
Wow,
just from 3 ounces.
That's a lot. Now, as we're getting to wrap up the show, Allen, just share with our listeners, how could they get in contact with you and also obtain a copy of your book?
Well, my book is available on Amazon, and it's also available at allensinc.com, ALLENSINK.com. I've written several books, and I buy them at, I can get an author's discount. I sell them on my website cheaper because I'm trying to get the message out. I'm not trying to be a millionaire. I want people to understand how important this is. And also, if someone wants to get a hold of me and reach out on the P.H.A.S.E website, which is Preventive Health and Safety, preventivehealthandsafety.com, you can actually go into contact us and just put your email in there, and I get back. I have a lot of people do that. They'll ask questions, and I get right back to you. I have blogs on so many things, so I'll be glad to send you something.
Wonderful. Thank you, Allen, for being here. I appreciate you coming on the program. I'm Dr. Saran Heron. It is such a pleasure talking to you today, Allen, and dedicating your time to educate others. We must change our mindsets. Take steps today to help us to live a better lifestyle, whether it's one's food choices, some form of exercise, ensuring we get our health screens done. Let us not become a statistic or wait for a disease to happen. Prevention and better choices will help you live a better life later. Blessings to you all. Thank you for listening to this week's edition of Rise, available wherever you listen to podcasts and always right here on the voice of Nassau Community College, 90.3 WHPC.